At the Derbyl Health Service, staff are working hard to vaccinate as many people as possible.
So you've had your first dose. Yes. How do you feel?
But with COVID-19 spreading throughout regional and remote communities in the east, there's a sense of urgency.
There is real concern across the east of Australia of the current crisis might creep to us.
Just 15% of Indigenous West Australians have had their first COVID shot, and only 7% are fully vaccinated. That's around half the national vaccination rate of eligible Indigenous people.
At the current rate of vaccine delivery, Aboriginal and Torres Strait Islander people in Western Australia won't reach 80% coverage until around 1 year's time. So we definitely need to just pick up the pace.
The Premier is also concerned and says the government is still considering what rate of Indigenous population would need to be vaccinated before COVID-19 restrictions are no longer necessary.
The responsibility for the remote communities is the Commonwealth's. I'd urge them to put more in-reach in and to work very hard to get Aboriginal people vaccinated.
The Derbyl Health Service says it doesn't have the workforce to meet the community's needs.
We've moved from vaccine hesitancy to concerns about demand. The demand is there. We're not able to keep up with the demand with the number of staff.
When we look at a blitz at the moment, it's a fantastic initiative as a state level. It's very broad and it's great, but that doesn't really answer the question of how we're going to uptake the high-risk groups. And we really do need to look at a high-risk blitz after this statewide blitz is completed.
Around a quarter of all eligible West Australians are now fully vaccinated. Rhiannon Shine, ABC News.